to show you a couple of blood vessels that are important, but that most of you have missed because they're kind of out of sight. So it is good to get in there and begin cleaning away all the peritoneal folds around your mesenterics and intestinals. But before you get to that, I want your thighs and shins done. I want all this posterior abdominal wall area done. So you can see here that we can see the aorta. We can see the post cava. Our iliolumbars are showing okay, but this area is okay. But as we work our way down and all that, look at this and say to yourself, would you be happy if I put this on your practical? Would I be able to see it clear enough to identify it? And if you look at your animal and say, no, I would not want that on the exam, then that tells you you've got more cleaning to do. And that's a lot about what this is. Just like when you were working on the forearm and shin muscles, you found that you thought you had them showing, and then you're like, oh, I need to clean that up a bit so I can learn it better. That's going to be a lot of studying for blood vessels. But what I want you to look for are a pair of midline vessels. But although they're midline, we still see them better on one side. And I'm going to cut this down just a little further so you can see that easier. So moving all of the organs over to the right, here's our abdominal aorta, also called dorsal aorta. Clean that up just a teeny bit more. And as I'm working on it, you can see two branches right there, right on either side of the scissors, the AR-13s. And these two branches are kind of important, so that's why I want you to find them. Now I've moved over the kidney, so let's put that back as I do this so it doesn't totally mislead you on what we've got here. Okay, maybe I shouldn't have done that. Here we go. So you can see I'm just opening that up. You can begin to see things a little better. You want to make this as easy to identify as possible. Boy, this is not easy on this one. Should have grabbed a different specimen. Sorry about that. Here we go. There they are. So this big vessel here I'm starting to expose is a pretty important artery. It's going to service all the small and most of the large intestine. This is the superior mesenteric. And even if you hadn't seen in your reading, which you should have, you would have been looking for it because many of you have already exposed the inferior mesenteric down here, right? And why would you call it inferior if there wasn't a superior somewhere? Of course, really it should be called cranial versus caudal, but again, typically we use the human terminology for these things. And above that is another artery, kind of running parallel to it. This artery is called the celiac trunk. Whoops. See how well you can see that. So here's our diaphragm, and the first branch coming off is the celiac trunk, and the second branch is the superior mesenteric. Now, because you've got rats, all you need to know is celiac trunk, but the celiac trunk has three major arteries coming off of it. One going to the liver called the hepatic, one going to the stomach called the gastric, and one going to the spleen called the splenic, which as I go through that sounds really moronically simple, but that's the nice thing about these visceral blood vessels. They're named for the organs they're servicing. All right, so superior mesenteric, celiac trunk, of course, here's your adrenal gland way up. A couple of animals have some fairly, oops. Okay, I guess you can't see it at all, sorry. Pretty high up adrenal glands right below the diaphragm. There it is, you can see just the tip of it. Now, another thing, while I've got this animal here, you're going to want to cut some windows in the animal, digestive organs. And a couple of them that are really good to cut open are the stomach and the duodenum. Before I do that, because I know a couple of you are having trouble with this, here we got a little bit of mesentery still here. Let's get rid of that. Here we have our spleen. And all of this here that's kind of lobulated looking is the pancreas. This is the gastric globe on the greater curvature of the stomach. And as we get over here, ooh, this is really dyed. That shows there was a latex blowout of the arterial pink. But here we can see this lobulated thing again. This is the pancreas along the duodenum. Now, in some cases, you're going to easily see a blood vessel going through the pancreas to the duodenum. We can see the artery there. And I guess on the screen you can see the yellow of the vein running parallel to it. Those are the inferior pancreaticoduodenals. You can't do more to clean that because you'll destroy the pancreas if you do. It's just, do you see it or don't you? We're going to see a lot of that with the blood vessels of the mud puppy, that either you're going to see them or you're not. And ooh, there we go. There's the superior mesenteric vein leading into the portal vein. We talked about that in a lecture the other day. All right, so organs you're going to cut windows in. First one will be the stomach. And this little rat's stomach is full. So there'll be some stuff squishing out. So that's something to look forward to. What? So here's the greater curvature of the stomach, right? So I'm going to come around here. Hopefully this will make it easier for you to get things. I'm going to pull on the greater curvature and take one snip all the way through it, another snip all the way through it, and then on just one side of the lumen, I'm going to connect the two. So this opens and closes like a window. And then we see all this brown stuff coming out. Who made that noise?
Sorry, that was me.
It's okay, it just looks like nougat out of a Three Musketeers bar.
Don't say
And yeah, you are going to squeeze it out. Otherwise, it's going to keep on getting on you and following you home. So this is rat chow. And if your animal's full, yeah, you're going to have a lot of rat chow and you're going to have to just clean it out. That's not that big a deal. But if your animal wasn't full, or only partially full, you should be able to see folding in here, which would be the rugae. The duodenum cut is going to be a bit more challenging because you don't want to cut into the pancreas and all that. So you want to go a little beyond the pancreas. You don't want to damage your pancreas. It's a fairly important glandular organ. Here's a nice section to work with, but we want to be careful because the small intestine is so small on these animals. So we're going to do the same thing, same 3 cuts, but be careful not to go the full length of the, or width I should say, of the small intestine. So 2 cuts all the way through. Oops. And then grab that piece, connect it. Just be careful to make sure you get your tine in there because everything is so tiny at this point. Oops. And then you can open it up. And we got food in here also, unfortunately. Makes it a little hard to see, but when I lay that out, see all that like bumpy stuff there? Those are the villi. Alright, just don't want to cut all the way through your small intestine to show that, but a little window here is fine to take a look at. Alright? And in a little bit, when more of you are ready, I'll demonstrate how to open up the chest. Which will be different than the way it's described in the book.